Thank you, everyone, for joining again on our Thursday COVID-19 briefing. Before I get started today, I just want to speak again to the folks in Bradley and Hamilton and Marion and Polk County, those that are still recovering from the tragedy Sunday night, that are cleaning up and beginning the thought process around rebuilding. Certainly, it's been a tragic situation there on top of the pandemic that we are all facing, and our hearts and our prayers are still with you, and our support on the ground is there as well. We stand behind you, we stand with you, and we'll continue to do that in the days ahead. All Tennesseans are with you as you rebuild from this real struggle that you face in your community. We've been doing these briefings for a number of weeks now, and I have enjoyed the opportunity to be able to share with you the progress that we're making. We're very encouraged, in fact, with the progress that not we are making, but that you are making in our fight against COVID-19. Tennesseans have paid quite a price. They are working diligently, but they're also sacrificing in a great way to make sure that this virus spread is mitigated. I want to just encourage you to stay strong in the efforts that you have made so far and continue to make. The small things, washing your hands, staying away from people, staying home when you're sick. And I also want to remind you to pay attention to how you feel, because as I said yesterday, if you are feeling unwell or you've been close to or around someone who has had COVID, we encourage you to reach out and get testing. There are 15 new drive-through pop-up test sites across the state this weekend, in addition to the vast number of testing facilities we have all across our state. All of this is in an effort to expand testing in Tennessee, so we encourage you, if you are not feeling well for any reason, to go out there and get tested. It will give us a greater understanding of how the virus is moving in our state. Just part of the reason that this briefing is later than usual is I just got off of a call with the White House and with President Trump. In fact, I was asked to speak on that call about the efforts that we are making and the progress that we're making in Tennessee. The call was a call with governors from all across the country to listen to the president as he outlined his plan for reopening the United States economy. Our team will be reviewing the plan that they delivered to us during the call. But at first sight, I think the president and his team are headed in a very good direction. A key aspect of his plan involves the staged reopening of low-risk areas around the country. And that is certainly something that our team is looking at and has been now for the days since we started the Economic Recovery Group to determine just how it is that we will phase the opening of our economy right here in Tennessee. I am proud of Tennesseans and the way that they have conducted themselves during the crisis. And as we begin to open things back up in the very near future, it'll be no less important to continue the practices and the habits around social distancing that we have done so well as a state in the past weeks, that have gotten us to the place where we are today. The more we stick to those social distancing practices as we open up, the more robust our opening can be in combination with the health and safety of our people. Make no mistake, we are ready for Tennesseans to get back to work. And as our testing capacity and our healthcare capacity continues to improve, we will be better able to open up more parts of our state. We can and we must open up our economy while encouraging Tennessee businesses to prioritize the health and the safety of their employees and of their customers. Our Economic Recovery Group will be giving guidance to industry, to companies, to businesses across the state on just how they can do that. As I said yesterday, I've appointed our Department of Tourism Commissioner Mark Ezell to head up this Economic Recovery Group. We are including parts of our states, the departments all across our state: Economic and Community Development, Finance Administration, Revenue, Department of Ag, Department of Commerce and Insurance. But most importantly, we are including industry leaders in this economic recovery group. And we've identified industries that are core to our state's economy: agriculture, hospitality, manufacturing, construction, and many others, to make sure that we represent small businesses and large companies alike. Government perspective is good, but outside perspective is what really creates policy that works for the people. And the industry groups that are bringing diverse thought and working solutions and robust communications to us, and to do the same thing for their employers and for their employees, will allow us to open up our economy more effectively in the days ahead. We not only want to hear from the folks on our economic recovery group team that includes industry and folks from our team, but we also want to hear from you. We want to hear from businesses and business owners across our state. Please go to our website at tn.gov to share how COVID-19 is affecting your business and how it is that you can give us input on how best to effectively open up our economy in the days ahead. Homegrown help is our main focus, but the federal response to COVID-19 has been comprehensive, and it's resulted in a critical funding opportunity for our state. The funds from the Coronavirus Aid, Relief, and Economic Security Act, or what many have been talking about in the last several weeks called the CARES Act, those funds will begin flowing into our state tomorrow. Tennessee is expected to receive more than $2.3 billion of CARES Act funds, with additional dollars being delivered directly to the cities of Memphis and to Nashville from the federal government. This funding provides tremendous opportunity, but it also creates, it has a significant level of responsibility to it in order for us to utilize these funds most effectively in our state. So we're partnering with the legislature and with constitutional officers. I've pulled together a bipartisan group to steward these funds to make sure that they're well spent in our states. I thank Lieutenant Governor McNally, Speaker Sexton, Senators Watson and Akbari, Representative Marsh, Representative Love, and Comptroller Wilson. They will be serving on this finance team that will steward the federal funding that's coming into our state, and I appreciate very much their efforts in this much needed resource and this great responsibility that we have, but the great opportunity that we will have to continue to expand our efforts in mitigating the spread and in producing economic activity all across our state, which is something that we are ready to do. Before we have questions, I'd like to ask Dr. Piercy to come up and give her health report, please. Dr. Piercy.
Thank you, Governor. Good afternoon. Today's case count is 6,262, which is a 3% day-over-day increase. That is the smallest day-over-day increase we have seen, and we are confident we are flattening the curve. We've had 691 hospitalizations and 141 deaths. We've done over 85,000 tests, and we continue to expand that effort. To reiterate yesterday's message, we want to make sure that everybody who thinks they need a test gets a test. Whatever barrier there is to testing, we want to try to remove that. Interestingly, I think many people heard the message yesterday, and that's encouraging. By lunchtime today, some of our health departments had seen 2 and 3 times the amount of people that they typically see. We're encouraged by that and want to remind you that you don't have to wait until the weekend to get testing. You can go to your local health department. We do encourage you to call ahead, but you can go there 5 days a week and get testing or come on the weekend, as we talked about yesterday. Finally, I do want to encourage you to visit our website. All of those sites for weekend testing are listed there. And I also want to remind you that if your site or your locality is not listed this week, check back again next week, because we will be adding new sites for next weekend with a goal of covering all aspects of the state in the next few weeks.
Thank you, Dr. Piercy. Before we take questions, I want to remind everyone we have members of our Unified Command Group here to answer any questions around the work that we're doing, and we're happy to open up the lines for questions.
Thank you, Governor. First, we'll go to Jonathan Mattias with the Associated Press. Jonathan, your line is open.
Hey, Governor. Thanks for taking our questions.
Yep.
I wanted to see, is there a level of testing that you would like to see that would make you comfortable enough in the reopening process? And also, you said there are some, you're thinking about reopening in different places, different locations. Which areas are you most comfortable looking forward where you would reopen first potentially?
Yeah, your first question about the level of testing, we know that we need to have expanded testing. So the first phase in that is to allow folks that are feeling the need to get tested who may not present with the traditional symptoms of a fever or a cough or that what has traditionally been listed as symptoms for COVID, but just if you're not feeling well at all, to get tested. That will expand the numbers as we just talked about, the new sites that we're putting in across the weekend so more people can come. Just the announcement yesterday put more people in the testing realm. There is a limit to the number of tests that we have on hand, but that limit is continuing to expand all the time. We are looking for new sources. There are new opportunities and new technologies around testing coming in the coming weeks. What we really believe is this expanded testing, which will ultimately move into antibody testing that will allow us to know who may have had exposure to the virus but were asymptomatic or didn't know they had it. That will also give us much more understanding of what our population spread has been. We are ramping up our contact tracing efforts as well. I believe we're on tap to add about 150 folks to that contact tracing with additional folks in the following week. All of those efforts, I can't put a number on those tests, but all of those efforts are going to significantly increase our ability to know how this virus is spreading so that when we do begin to take steps to open up our economy, we'll have a real understanding if we are increasing cases, where they're increasing, where we have a challenge, where we need to make adjustments to our phased opening. All of those will be important as we go forward. It will just provide us with more information. We don't have a target number of people that we want to get tested. We just know that we want to test as aggressively as possible to the limits of the capacity that we have. What was your second question?
If there are specific areas that you're looking at now that would be, comfortable at this point as some of the first wave opening.
Yeah, what I would say is that we're looking to the Economic Recovery Group to provide a strategy for this phased opening. And one of the considerations that we're making is geographic regions of the state that have very few cases or that have had no significant spread. That is enhanced. That data will be enhanced over the next week or two as we expand testing into more far-reaching areas, which will start more aggressively this weekend. We haven't made decisions about how it is that we will stage this reopening specifically, but certainly geographic considerations will be weighed in as we develop that plan.
Thank you.
Mm-hmm.
Next, we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Hey, Governor, I wanted to see if you can kind of elaborate on sort of the next phase. Obviously, testing is important, but also looking at the economy and the state's budget. Have you been thinking about, when lawmakers return, how you might scale back or change the budget? Might it include, as we've seen in some other states, discussions of furloughing or laying off state employees, as has been done previously in Tennessee?
So the legislature is scheduled to come back in June, and we'll certainly, part of that conversation when they do is, and already before that, conversations around our budget are underway even today. So This has not been going on very long, but we're starting to understand potentially the projections that we see around revenue decline. Certainly the revenues for the state have declined significantly in the past few weeks, and will continue to do so. The economy is going to has taken a significant hit. It's early yet to know what particular impact that's going to have on the state, other than to know that it will be significant and the revenue reductions will be important. We're beginning to look at those and think about, that'll be a long process. That will be a process that lasts throughout the summer, into the fall and into the end of the year, to determine just what next year's budget will and should look like, and then the steps that we'll have to take as a state to match the revenues with the budget itself. It's early in the process to make many assumptions about what that look like, but certainly we'll have to adjust our state's budget to meet the new revenues. And the further this tracks, and the more weeks that go by, and the more we understand exactly what we think our revenues are going to look like for the rest of the year, that will inform the decision-making process over the summer that we will have to make to adjust our budget.
And then just real quick follow-up, the Stimulus Financial Accountability Group with a handful of lawmakers, as well as Justin Wilson and others on there. How will those decisions be made about what gets funded? What kind of transparency will there be? Will we be able to watch those meetings?
The first of those meetings has been set. I don't know the dates of it. I'll determine that, but we'll absolutely have transparency. Those meetings will be open. There'll be full transparency about the discussions and the dollars and where they will go and how they will be distributed. That first meeting has been set, and you'll get details about that. But yes, it'll be an open, transparent process.
And any explanation on the criteria for what's chosen to fund and what isn't?
Actually, there are some very clear directions regarding the pots of money. The federal government has given outline of the amounts of money that will come to each state, and some broad generalizations about how those monies will be spent: education, healthcare, individual assistance, business relief, direct COVID expenses. So there are guidelines already given by the federal government, but there is a lot of detail that has yet to be delivered by the federal government, and there's a lot of work to do to assess these dollars and begin to make decisions about how they can be best spent across the state. That process is really just beginning. The money will be delivered to Tennessee tomorrow, and we've just received that first broad package of guidelines, but it's
So I believe your question was about this is kind of technical, but to answer your question, you were asking about the reproduction rate. And that is essentially the average number of people that an infected person infects. And I think you quoted that it began at around a 5. That was true in China, and that may be true in heavily populated areas, but here in Tennessee, it was somewhere between 2 and 3, maybe 2.6 or 2.8 at its highest. Right now, the last estimate I saw is around 1.3 or 1.4. Ideally, we would like to get this under 1. To answer your question about lifting some of the social distancing restrictions, we do expect that to creep up, but we want to keep that number as low as possible. And so that's going to be why it's very important when we do start opening things back up for people to use good hand hygiene, good respiratory hygiene, and use all of those social distancing measures, face mask, all of the things that we're doing right now in order to keep the reproductive rate as low as possible, because the worst thing that could happen is that we open things up too soon and we relax the social distancing too quickly. That number jumps back up and we'll find ourselves in a similar situation that we were in several weeks ago.
Thank you.
Next, we'll go to Stephen Elliott with the Nashville Post. Stephen, your line is open.
Thank you. I may have missed it on the slide, but did you consider putting any workers or worker representatives on the economic recovery group?
Can you say that one more time, Stephen?
Yeah, sure. Sorry. I was asking if you considered putting any workers or worker representatives on the economic recovery group.
Well, the Economic Recovery Group is made up in vast part by industry folks who are employing tens of thousands of workers. So restaurant owners who employ thousands of restaurant workers, their restaurant association who represents those employers and those industries and those workers. That's how we put together that team.
Next, we'll go to Ainsley Daniel from WJHL. Ainsley, your line is open.
Hi, Governor Lee. Thank you so much for taking our questions. So here in Northeast Tennessee, health experts say that we could potentially be weeks away from the peak of cases for our region. So how do you plan to safely open the economy in parts of the state that are behind the curve when it comes to the number of cases?
Yeah, I think it's a really good question, and Northeast Tennessee is a good example of how well prepared your portion of the state has been. So as you know, you have vast hospital capacity there. I think the major hospital system there just furloughed, I believe, 1,300 workers because of the lack of activity in the healthcare system there, because of the efforts that have been made to provide for hospital capacity. That was the thing that we were working most to do. The curve had to be flattened so that we didn't strain our healthcare system, and we're at a point in this state now where we see that we've accomplished the goal of flattening the curve, and we have a significant amount of healthcare capacity, particularly true in your region. So the most important thing that we can do is we no longer have to rely only on models that predict the future. We now have weeks of data that tell us exactly what's happening on the ground with hospital capacity. So we get reports from hospitals all across the state that inform us exactly how many patients are hospitalized with COVID and how many available beds we have. Those available beds are in the thousands, and in Northeast Tennessee, the capacity is significant. So how we can accomplish opening up the economy and maintaining that safe environment is to watch those numbers every day. We will continue to monitor the capacity, the prevalence of personal protective equipment, the amount of healthcare workers that we have available, and certainly in your region, there are a lot available because the significant number have been furloughed, so they could be brought back on when the need arises. The most important thing we have to look at is the safety and the health of Tennesseans. But we can begin to open up the economy because now we can track exactly what's happening in our healthcare systems to make sure that we maintain that capacity. And when we begin to see that capacity being depleted, then we can make adjustments to that opening. That's how we plan to do it.
Thank you.
Mm-hmm.
Next, we'll go to Hannah Wallsmith with WMC. Hannah, your line is open.
Good afternoon, everyone. You're watching Governor Bill Lee and his daily update here of the coronavirus on Tennessee. We're going to continue to join him in progress as we begin News 4 at 4 o'clock.
The CARES Act has a couple of significant portions of funding for all of our public schools all across the state. So every district in every region of the state will receive funding as a result of the CARES Act. And that too, like all the rest of the funding, will be, we'll understand more about the particulars around that, how it can be spent, what it's to be spent on, what the full amounts are for each district. And the legislature will work with us, members of the legislature will work with us to steward those funds.
Thank you.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Thank you, Governor, for taking questions this afternoon again. Do you have a ballpark figure on what you referred to as significant loss of state revenue, and how much reworking will that create for the emergency budget that was passed last month by lawmakers?
Yeah, it's fortunate that we passed the budget when we did in our state, because we're at a position in the legislature, and I commend the legislature for taking very difficult steps to reduce the amount of increased spending that we were going to propose, or that we had proposed, and that was in the current budget. But the legislature made the very difficult decision to reduce the amount of spending that we were going to do as a state, and to take off the table a number of initiatives that they had worked very hard and we had worked very hard to put in place. So we're fortunate in that we passed that vastly reduced budget at the time that we did, but we will make additional adjustments to that budget likely as a result of the reduced revenues that we will understand more as the year unfolds. It's really early to know what the impact of this COVID-19 is going to have on our economy. We know it's going to be difficult, and difficult is not an appropriate enough word for how hard this might hit our economy and our state's budget. We know it's going to be significant, but we're just a few weeks into this, so a real understanding of that's not possible right now. We just seen enough to know that a lot of the work that we have before us is to make adjustments to that state budget in a way that fits the revenues that are coming, so that we can be good stewards of taxpayer money in the year ahead.
Well, with that, if I may follow up, but do you physically see the lawmakers back in Nashville on June 1st, or might you be considering things like teleconferencing, and you may not have all the information you need to address the budget issues you just mentioned?
Yeah, it's hard to know what's going to happen in June. This has been so quickly changing over the last few weeks, so we certainly will. When we get closer to the time when the legislature is due to reconvene, we'll certainly assess that, but we don't know what's going to happen in June. We just know what we're hoping happens over the next couple weeks.
Thank you, Governor.
Yes, sir.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
Thanks again for being here. This has been a very difficult week for a lot of Tennesseans, not just because of COVID, but because of the storms. And while this week has brought significant challenges to our state, once again, I've been really proud to see the way that Tennesseans have taken heart, and that they have stepped up, and that they have served their neighbors, and that they have continued to be Tennesseans in ways that you only can be. And the more I do this, the more work we do on this, the more proud I am of the way that Tennesseans respond when they have to respond. So continue to do so, continue to take heart, continue to be hopeful. We are certainly hopeful here about the days ahead in our state, and thank you for what you're doing. Just remember to do your part and stay apart. Thank you.
And with those words, you've been listening to Governor Bill Lee address the state here at 4:06, so about 36 minutes here, a little later today. We want to officially welcome all of you. We're going to give you a recap here.